Well, several world-renowned companies, including some right here in Massachusetts, are working around the clock to discover a vaccine. State government is developing a plan to distribute the vaccine safely and equitably based on federal guidelines. On Friday, our administration submitted its interim draft COVID-19 vaccination plan to the CDC, which is a requirement for all states. The plan was developed by an interagency vaccine working group that was led by the Department of Public Health and advised by our COVID-19 Vaccine Advisory Group. We've relied on some of the brightest minds in the public health space to put this together, and our medical advisory group includes medical professionals, public health experts, elected officials, community leaders, and infectious disease specialists. The plan lays out initial steps in our state's planning for a robust, comprehensive, and equitable vaccine distribution system once one or more vaccines are available here in the Commonwealth. We're planning for different phases of distribution based on how many vaccines are available and when. In the early phase, we expect limited supply, and we plan to prioritize the following groups: healthcare personnel who are likely to be exposed or to treat people with COVID-19, people at increased risk of severe illness from COVID-19, including individuals with underlying medical conditions and those over the age of 65, and then other essential workers. The plan also outlines our messaging efforts to make sure people know, once there is a vaccine available, that it has been approved by the federal government and is safe and effective. We'll also make it a priority to reach out specifically to groups that have been disproportionately impacted by COVID-19, including people and communities of color. While this is an interim plan that will probably change as more information becomes available, it's an important step forward as we continue to work toward the day when that vaccine is available for use. And while we continue to plan for a distribution of a vaccine, we can't take our eyes off the measures that we've been talking about for the last several months to keep people safe. As many epidemiologists and public health experts predicted, we have seen an uptick in positive cases in Massachusetts, across the country, and in many parts of the world. While we continue to closely monitor new cases, including testing and tracing where the infections are most prevalent, our Commonwealth is in a strong position to keep fighting this virus. Since last spring, we've made significant progress to build a massive infrastructure for large-scale testing and tracing. We've stockpiled enough PPE for frontline healthcare workers to last us through 2021. We've created and sustained a gradual reopening of our economy. People are back to work, and businesses and schools are in business. We all understand just how incredibly contagious this virus is and what we all have to do to stop the spread. And as I said, the virus is here to stay until there's a vaccine or a treatment. Our best defense is every single person doing their job and taking the responsibility to protect themselves and each other. That means, once again, wearing a face covering, practicing social distance, not hosting or attending large gatherings, especially those indoors as the weather gets colder, washing hands and practicing good hygiene, staying home if you don't feel well, and getting tested for any of the reasons I suggested before, and many more.